Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit, consumer-centered organization committed to fulfilling the health and residential needs of the people in the communities we serve. I'm your host, Jennie Sutherland. Welcome to InfoSource. We haven't done a show in quite a while due to the COVID-19. Here we are, we're Zooming it, and I have with me Dr. Kyneret Albert from HCIB, Hospice Care in the Berkshires. Sorry, I'm abbreviating because I'm excited to be doing a show. Welcome aboard, Doc.
Thank you. Thank you for having me.
Thank you for joining us. And I mentioned to you, we did a show about 5 years ago, might have been 4 years ago. And it's nice to have you back. And how are you doing? Are you at home right now?
I am. I'm at home in my basement.
In your basement?
Dogs quieted, yeah.
So the dog's not going to like photobomb the...
That's the hope.
Okay, all right. I think some of our viewers might like that if that happens, so don't have to freak out about it. We tend to have animal lovers on watching. So, Doctor, you've been in Berkshire County for a long time. Every time I say your name, people are like, oh, I know her family, blah, blah, blah. So are you a local Berkshire County girl?
No, not originally. I actually grew up in the Pioneer Valley, but after my husband and I met in medical school, we were looking for a place to settle. And so we've been here for just about 18 and a half years. Our kids have grown up here. We've both been very happy in the healthcare. We're both physicians and we're very happy in the healthcare system here. So when we first moved to the area, I did primary care for a number of years. Mm-hmm. And now I've been working for hospice care in the Berkshires for about 15 and a half years.
Yeah. So I'm from the Pioneer Valley too, and this show will be seen in the Pioneer Valley, so that feels comfortable. And at Hospice Care in the Berkshire, you're the medical director, and I know you worked very close with that team. And how did you get involved with them? How did you go from your practice? It was just a conscious choice?
I was trained as an internist, and like I said, I did primary care out of the area and in the area for a bit after I finished my training. And then, life changed a little bit. I had mm-hmm. 2 small kids, and primary care is a very challenging job. I commend everyone sure. who does it, and it just wasn't working out with our family. And right around that same time, hospice care in the Berkshires was beginning to grow and was looking to employ a physician very part-time with the goal of having that role increase over time. So it worked out perfectly. So I started out, I think I was working something like 8 hours a week. And not only has the agency just gone through so many changes since then, but the industry has changed a lot too. The role of the physician in hospice has really grown, and it was my incredible great fortune to have been introduced to to hospice in general and hospice mm-hmm. care in the Berkshires specifically. I actually have my husband to thank for that. He was on the board at the time and said, I know someone who is looking for a few hours a week of work. And it's just, I've been very, very, very grateful and fortunate to have been connected to this agency ever since.
I think it's amazing how things that are supposed to happen work out. So, yeah, and I think it's pretty cool that your husband was on the board. So that's a nice story. I think it's important for people to realize how we get involved in the different aspects of the healthcare industry. And certainly this work, there's a wide variety of things to do. And I'm glad you're work with the hospice folks. They're just lovely, lovely people. And I've had many of your colleagues on the show before. They're great. When you and I talked about doing this show, you said you wanted to kind of give an overview of hospice. So let's start there because some folks might not know, and then we'll get into some of the topics you and I specifically want to address. So just an overview, Doctor.
Sure. So hospice is incredibly robust set of home-based services mm-hmm. intended to provide interdisciplinary care to people who are approaching the end of life and really focusing on making that time as rich and positive and beautiful as it can be under the circumstances that they're in. So like I said, it's provided by an interdisciplinary team, meaning that it's been recognized from time immemorial that people who are approaching death really have very complex needs and challenges, both their medical concerns, for many people they have spiritual concerns, sometimes there are social obstacles, isolation, even more exaggerated now in this time of the pandemic. Potentially care needs, their family could use support, and it's really built into the hospice model that both our patients and their families receive support by people who are specialists in that area. So the team offers, like I said, social work for emotional support, and also assistance in kind of navigating some of the challenges that face people when it comes to either changes in their finances, or perhaps they are a veteran and have access to resources that our social workers can help them access. So both concrete services as well as emotional support for both patients and their families at this really unique time in their lives. We also provide spiritual support. Like I said, we provide personal care through our aides. And when I say, just to backtrack a moment, that this is a home-based service, I want to emphasize that home is defined as wherever a patient lives. So we provide services either in a home, or in a skilled nursing facility, in assisted living, wherever the patient lives, we will come to them and offer them their services. It is in addition to being kind of a philosophy of care, it is also an insurance benefit that people can opt to utilize, meaning that for most people, all of our services are covered through their insurance through no cost to themselves. And it is a voluntary service. So someone agrees to enlist our support, and the ins and outs of that are explained when the time comes. So that's hospice kind of in a nutshell. It's for people who are approaching end of life and have really come to a point either in their disease or in their emotional process where they really are prioritizing quality of life as they define it. For some people, that's a prioritization of comfort. For some people, that might be a prioritization of being kind of cognitively intact. Our first question to people when we meet them is, how can we help you? You are in charge, your values drive the services that you receive, and we go from there.
I want to go back to some of the stuff you shared at the beginning of what hospice is, the spiritual and emotional with social work support, because it is, a physical process you're going through, but it's also an emotional and spiritual one. And so I think a lot of times people think of hospice that it's just the body care and the disease process or whatever that's going on for folks. And it's not. You help folks make lists of people they want to thank or say sorry to or whatever, connect with different people. Some of your colleagues have shared with me taking folks out on boating, fishing trips. That's one of their last things they want to make sure they do. And to me, that is just as important to meet as the physical, disease process and end of life process, and the spiritual things as well. I mean, if people find comfort in that, and it's wonderful to have the whole, care package from you guys. And then the other thing is I don't think people understand the finances of it, that it's available to people. They think, oh, that's got to be an extra thing, expensive, or take away from, if their home is a skilled nursing facility or assisted living, take away from that, but it's an addition. So
so just to clarify that we have social workers, and we also have chaplains. So who specialize in the spiritual component of care. And I was just speaking to one of the wives of one of our patients recently, and she spoke just so eloquently about how the chaplain had really helped her and her husband name what they were feeling. They felt so alone in this process, and to be able to identify what they were experiencing, to know that it was the normal part of the process of preparing to lose this meaningful relationship was, she said it took a time that she was dreading and made it into something beautiful, which I think really summed up what it is that we do. But yes, in terms of the financial component of things, and sometimes people are almost embarrassed to ask, as if there is something kind of they shouldn't be worried about that kind of thing right now.
Well,
but of course
I'm making eyes because that also is very human nature. This is a hard thing, but what's this going to cost?
Pay for it. Exactly.
And I don't want people to think this is a barrier, because it is not. You guys can talk them through things. So
sure.
Very good.
Yeah. So it is the way that skilled nursing facilities are paid for is complicated outside of the scope of my practice. But certainly people can receive hospice services while in a skilled nursing facility, and the services, if the criteria are all, I'm kind of hedging a little bit because there's a few kind of weeds that we could dive into, but the hospice is covered by most insurances. And what is covered typically is all the people that I just referred to, the nurse, social work, chaplain. The relationship is maintained with their previous provider, their nurse practitioner or their physician, so that relationship can continue. The social worker, the chaplain, the aides. We typically have volunteers that visit the home. That is one thing that's, because of COVID, a lot of our volunteers are communicating over the phone a lot more now, and hopefully we hope to get them back into the community when it's safe for them to do so. All of these services are, as well as a bunch of consultants, which I didn't even touch on. We have music therapy, we have wound care, all that kind of stuff.
Massage therapist.
Right.
I always remember that one.
So all of that, by most insurances, is provided. There are sometimes funky insurances. We had someone one time who had a specialty insurance that he was a firefighter in a small hill town, and we always try to we make it work.
I mean, I think what we want the majority of people to know is that please just, if you have a question, call and ask, but it's not this. That shouldn't be a barrier, and you'll work on it. So,
exactly. I shouldn't go off on tangents. But for almost everybody receiving hospice services is receiving hospice services using their Medicare benefit, and their Medicare benefit is available to people 65 years of age and older in this country, and some younger people with certain conditions. And Medicare, which, like I said, is the insurance source that pays for hospice and 95+% of our patients nationally, and it covers all of the services that I spoke to with fully.
So you mentioned your volunteers in COVID. So what I'd like to do is take a quick break. We're going to watch a little video clip on hospice care in the Berkshires. When we come back, Dr. Albert and I will talk about, I'd like to hear about how you guys are doing with the COVID-19. Clearly we're Zooming here. I'm usually in the room with Ryan, the camera guy, and you. So I want to talk about what's going on for hospice care in the Berkshire with COVID. So we're going to take a quick break, and when we come back, we're going to go back at it again. All right, back in a minute.
I think the day that you are given the news that you have a limited prognosis, you can use all the help you can get.
When my dad was passing away, hospice became involved with him. There's a lot that we were worried about, and all of a sudden that big cloud was just lifted off. And we were able to just relax with my dad and enjoy his last day. So after that, I thought, when I retire, that's definitely something I want to do.
About 25 years ago, a very, very close friend of mine became ill, wound up with cancer. I had never seen hospice before. I was really, really impressed. He had this nurse that was like nothing I had ever seen, and all the aides and just the people and the staff, and they not only helped him, they helped the family. And that's what originally brought me to hospice, and I spent 9 years as a volunteer, which ultimately led me to go back to school so that I could do spiritual counseling and chaplaincy.
I have been a hospice volunteer for 11 years. When I talk to the patient, they are always upbeat. It's a wonderful, I feel like it's a wonderful ministry for me.
Everybody has a story, and those stories have meaning. And so part of the work as we move towards the end of life is unpacking that, so to speak, resolving things, letting go of things, healing things.
If ever anybody needs help at a time in their life, it's when they're facing this last tremendous challenge.
We have an amazing team.
The nurses, our beautiful aides, volunteers, social workers, chaplains, complementary therapists, everyone involved. You pick and choose from that team to see who can be the most helpful to you in your particular circumstance.
They're just such a comfort at a really difficult time.
One of the sad things for me is when hospice isn't utilized soon enough.
I think if anyone is thinking about having hospice involved with a family member, they shouldn't hesitate.
In all the almost 30 years I've done this work, I've had countless families say to me, I was nervous at first, but I can't believe I was nervous once they get to know us.
The care that they get from hospice, that it makes me feel that I'm doing something worthwhile.
We have the conversations, and sometimes difficult conversations, about what to expect as things progress and what you think you're going to need to live as hopefully and as joyfully as you can with the time you have left.
Just holding their hand and knowing that you're making a difference, they sense that you're there, and it helps them to be calm and to know that you can help someone to pass peacefully just by holding their hand. Is hard to explain. I can't put a price on that.
Welcome back to InfoSource. I have from HospiceCare in the Berkshire, Dr. Kyneret Albert. Thank you for coming on, Doctor. It's always nice to see you. She is talking about hospice services, and I was just asking about what it's been like going through this time with COVID-19. So, Doctor, this has got to be more for you guys to go through as with everyone else. What's going on?
Yeah, well, we have all been working very hard for months now to make sure that our patients continue to receive the services that they deserve in a way that's safe for them and their families. We've had an incredible response by the health system around us, both BHCS, the agency that we're affiliated with, as well as the whole Berkshire health system, to help us kind of navigate. You know, a lot of people know that Berkshire County was hit very early in the scheme of the pandemic, and we've been scrambling to keep abreast of all the challenges and new information that's coming at us, and like I said, to provide the best care that and safest care that we can for everybody. So we have been providing services without a hitch. We originally did some visits over the telephone, especially our social work and chaplain support, but those disciplines are back in the community, both in homes and in skilled nursing facilities. Different skilled nursing facilities have their own restrictions in terms of who can and who cannot visit. And I will say that our families tell us that it has been very meaningful for us to be involved with their loved ones when their ability to visit has been restricted. Just to know that there is an extra set of eyes on their loved one. They get more updates. You know, I think the skilled nursing facilities are working really hard to try and stay in touch with family members, but we add an extra layer of that. And that really sums up our relationship always with skilled nursing facilities. We come together as a team. You know, we come in with our specialty knowledge. They come in with their knowledge. Some of the people that we help them care for have been under their care for years and years. They're family to them. And so together we work together to give them the best care that they deserve, like I said at that time. But it really has, we've heard from a lot of families that having us in the facilities around this time has given them a sense of security that their loved one is being visited, socialized with, and getting good care.
Yeah, and certainly, I believe you're right. Before COVID, I think the extra hands-on and extra eyes and different reporting in is meaningful to families, but also just now where they can't go in and visit for that socialization and emotional support. And I think that is priceless, a priceless service to the families and the residents and clients that you guys are seeing. So you guys are pretty much same on in the skilled nursing facilities. Can you still go into homes and stuff, like people's traditional homes?
Yeah, so like I said, some skilled, depending on where they are in this process, different skilled nursing facilities may restrict or expand access, depending on where things stand, so that we constantly stay in touch with the facilities that we visit to make sure that we're complying with their rules and regulations. We have been going into homes. Again, a lot of people are hesitant to invite more bodies basically into their home, and we work with them as respectfully as possible to provide people in the home for hands-on care, whatever we can do over the phone or over some sort of a video conference if that's what they prefer, but we are in homes. Like I said, the only caveat to that right now is we've slowed down a bit in our face-to-face volunteer encounters. Most of our volunteers, like a lot of volunteers, are retired people who themselves might be at high risk. So out of respect to their health, we have been cutting back on those visits. But we recently had someone who really needed a volunteer, and we were able to get someone who was younger and provided with the appropriate PPE and was able to make a face-to-face visit. So again, the bottom line on hospice is the patient and family's needs drive what we do, and we try and meet that in any way we can.
So, and we both have touched upon this through this conversation, and it's not just for the person going through this process, it's the family support. Certainly you guys offer a lot of support groups, individual kind of check-ins with social workers and things. Can you talk about that? Because again, I think it's like the finances, people don't understand it and think it's just for the individual, but it's not.
No, it's not. I think this is a very meaningful time for everybody connected to someone who's approaching end of life, and that we refer to the family, however that's defined, not necessarily self-defined family, as the unit of care, meaning that's who receives our services. So emotional support is given to family members. Logistical assistance, sometimes for a lot of people the hardest part about this is that they don't know what's going to come next, and how are they going to prepare for that? How are they going to care for their loved one when their ability to care for themselves decreases? And so we help them anticipate that, and as you say, access services if they needed, access a walker if they needed, that kind of thing. We also provide support after a patient dies. We offer what's called bereavement support, or support as someone is grieving for the loss of a loved one. And I just want to point out that although we definitely provide that kind of support to the family of someone who has died on hospice, those resources are available to anyone in Berkshire County who has suffered a loss, someone that they love has died. Whether their loved one is down the street or across the country, they should please reach out to our agency, and we're here to help them too. We don't just offer that kind of support to people who happened to have connected with us previously.
Yeah, and I guess I usually shout out to one of your colleagues. I'll shout out to Holly Merchant on that, because she is extraordinary, and we've actually have tapped into you and her and your team to help us with memorial services for residents and staff that we've lost during the COVID-19, not just to the virus, but who passed away from other things. And you guys came and helped us do a service here and a memorial service up at another affiliate. And it's just such an important thing, and that people need to realize that support's there for them, whether their loved one was on your services or not, because they should take advantage if they're able to. So again, something we got rid of finances pretty much. We're letting you know that there's support out there if people want it. I want to let folks know that Hospice Care in the Berkshires has a great website where you can find contact information. You can see more about their services. And the best thing to do is every time I call you guys over in the office, I get the best help ever. I get right to the person, it's different folks answering the phone, but they're always able to help me, even if I don't know who I'm looking for. So you got a great team. We have a couple more minutes here, and I just wanted to ask you, is there something, an experience to you that out of all this time that, I mean, honestly, people just adore you in this community. They say, "Oh, Dr. Albert," something about doing this work that's affected you.
Oh, I don't even know where to begin. First of all, I will say that although I thank you for saying that, the real heroes of our organization are out there. They're out there at the bedside caring for people with love and hands-on, and they're actually also the people who answer the phones and remember that everybody who calls us is having a bad day, and they deserve to be treated with respect. We understand people get angry and hurt, and they really, I couldn't be more proud to work with the team that I work with from every angle. I think people will often share with me a positive experience that they had with hospice where, like I said, it helped them recognize that this could be a beautiful time, a time of great sharing of emotions, and that's our experience every day. Certainly there's just yesterday. Yesterday, one of our social workers shared a story of someone who said that he hadn't realized how meaningful this time in life could be until our staff helped him see that it wasn't a scary time and it wasn't a bad time, that it was a wonderful time that allowed him to connect with someone. I remember years ago, we took care of someone who was actually, when we first met her, she was homeless. And the fact that our staff stayed with her wherever she went, and as her condition declined, that we ended up being some of the most constant faces in her life at a time when she needed it most. And I know I could, like I said, I couldn't be more proud of what our staff is able to do with the people that we encounter every day. Yesterday to 15 years ago, it's an honor to work there.
And so, to hear that people are grateful to have your services and work with you folks, but I also hear from you and others that y'all are grateful to do this work. And so I think that's why this works. You have gratitude and this opening up. So I want to thank you, Doctor, for coming on. It's very nice to see you, even though we're on TV together like this, and your colleagues out at Hospice Care in the Berkshires. Again, please go to their website and get their phone number, give them a call. They're so wonderful to talk to. Doctor, thank you. I want to thank folks for watching this. We are a production of Berkshire Healthcare Systems. Thank you for watching. I'm Jennie Sutherland. Till next time, good health, good life. Bye, Doctor. Thank you.
Bye. Thank you so much.